The Affordable Care Act? What is that?
Yes, great question. Let's do some research on it.
Sounds like a plan. The Affordable Care Act is a newer piece of legislation that was placed into law by President Barack Obama in 2010. It was meant to provide more Americans with affordable, quality health insurance, as well as attempting to curb the growth in healthcare spending within the U.S. This video will show how the Affordable Care Act has impacted U.S. health insurance reform. The areas of reform include new benefits, rights and protections, rules for insurance companies, taxes, tax breaks, funding, increased spending, the creation of new committees, and new education and jobs. The Affordable Care Act made it possible for millions of Americans to become insured with health insurance at an affordable rate. It also spreads the risk equally to all insured to end discrimination based on gender or health-related issues. With this law in place, it limits discrepancies on what a person can now be charged for coverage. With the new affordable choices, uninsured Americans with pre-existing conditions will finally have the choice of quality, affordable insurance. Small business owners will be eligible for billions in tax credits, and the new plans will offer preventative care and immunizations, as well as coverage for dependent children up until the age of 26. The new legislature offers more power for consumers by providing a new website to help compare the different insurance coverage options, along with state-by-state healthcare assistance. It also provides a new independent appeals process to patients to help appeal insurance company decisions. The law prohibits new and existing plans from denying coverage because of pre-existing conditions. Insurers with a pattern of excessive rate increases can be blocked from selling through the new exchange. It removes arbitrary limits on coverage on all plans and prevents companies from dropping patients when they get sick and need coverage most. A health insurance exchange is an online marketplace where individuals and small businesses can purchase health insurance. Exchanges provide oversight of health plans regarding new insurance, market regulations, consumer protection, rate reviews, and requirements, as well as premium taxes. The goal of the exchanges is to help small employers and their employees with the purchase of quality health plans. Quality health plans provide extensive coverage and meet all the private market reforms specified in the Affordable Care Act and can be purchased in the marketplace. Exchanges identify individuals who are eligible for Medicaid and other public programs. Those individuals documented as having a low to middle income will be able to obtain a federal compensation and cost-sharing assistance, which reduces the cost for purchasing health insurance. A requirement of the Affordable Care Act is that exchanges are established in every state. The state has the ability to conduct its own public exchange or partner with the government. If the state chooses not to administer their own exchange, then the residents of the state are able to purchase through the federal government's exchange. During the 2016 open enrollment period, public exchanges accumulated 12.7 million enrollments. State-based exchanges made up 1.3 million, while federal exchanges made up 9.6 million exchanges, which included federal and state partnerships. What does the Medicaid program have to do with the Affordable Care Act, and how will insurance premiums be affected? The enactment of the Affordable Care Act has insured more than 20 million Americans, where 17% of these individuals are enrolled in Medicaid. Because of this, the share of uninsured Americans has lowered to roughly 10%. Expanding Medicaid under the Affordable Care Act is not mandatory. 31 states and the District of Columbia have chosen to expand Medicaid to provide coverage to several groups who were historically ineligible. Some of the incentives that states are receiving are full reimbursements for new enrollees from a period from 2014 to 2016. Households earning as little as $46,000 a year will not receive premium assistance, but are still required to pay the unaffordable rates. 80% of young adults between 21 and 29 who earn 138% more than the poverty level will pay more out-of-pocket expenses for health coverage. What variables are in play in the political debate over the impact of the Affordable Care Act on the cost, access, access and quality of healthcare services being delivered to those who are insured. After the implementation of the Affordable Care Act, the cost of healthcare has risen. The cost of insurance premiums have increased. More individuals have access to care, which means they're now going to seek treatment. However, some individuals cannot afford the coverage and they're having to pay a tax penalty, which is creating a coverage gap. Federal funding is available to states who participate in expanding Medicaid. Since it's a voluntary program, not all states have chosen to participate, and those who are not are opting out of the additional federal funds. Hospitals in states that refuse federal funding may be impacted by decreases annually. With the introduction of the Affordable Care Act, more individuals now have access to health care, and more people are seeking treatment for preventative care. Not all physicians are accepting patients under this new plan. Physicians who are accepting low-income patients have longer wait times due to a shortage of services. As the shortage of physicians increases, it will impact the healthcare system due to more eligible patients enrolling for services. There is still the problem of the for-profit healthcare companies as they present barriers to access to healthcare and to healthcare reform. The doctors do not have to accept Medicaid or some of the other insurances available through the marketplace, and this places a large limitation for some to access to healthcare even with coverage. There are 5 key implementation challenges that are facing state and national policymakers regarding the Affordable Care Act. The cost of the premiums and deductibles are too expensive for most of the individuals and families that are now eligible to enroll. The health insurance plans are costly. People on the federally run exchanges need subsidies to purchase them. If they do not qualify for subsidies, few will be able to sign up. The administration had forecast that 7 million people would sign up and that 38% of them would be young people. Of those 2.2 million, 24% were younger Americans aged between 18 and 34. Without more customers, especially young people whose health costs are low, insurance companies will suffer. The administration forecast in a mid-range estimate that an average of 93 million people would lose their health plans in 2013. This includes 80 million people on employer plans and 13 million people with individual plans. Millions of plans have already been canceled and more cancellations are expected. In an effort to keep costs down, insurance companies are reducing the numbers of doctors on their insurance plans and even eliminating some of the more expensive hospitals within their network. With all of the various challenges that people are facing today, the expected enrollments are not taking place and millions of Americans are still left without proper health insurance coverage. Within the last 6 years, the Affordable Care Act has made several changes to the U.S. health insurance reform. Changes that included more people being insured with less discrimination, set amounts for yearly deductibles for insurance companies, and the expansion of Medicaid coverage. As the legislation looked good on paper, it was not properly implemented, and many of Americans that were supposed to get affordable coverage are still not covered because the plans were not affordable for them. Healthcare costs have risen, and people cannot afford to pay the doctor and the insurance premiums. While the Affordable Care Act is a good idea on paper, there's still work that needs to be done. It is a good start, but there are several challenges to providing quality coverage for all who need it. And that is how the passing of the Affordable Care Act has had an impact on the health insurance reform industry within the United States of America.